Welcome. I am Dr. Nicole Martin, your double board certified family medicine and preventive medicine physician. I help busy professionals use preventive and integrative therapies to not only improve the symptoms of many illnesses, but to cure some illnesses and truly save lives. Through my programs, seminars, and books, you will get healthy and stay healthy. You can find me on all social media platforms at drnicolemd.com. That is DrNicolemD.com. So today I'll talk about disparities in mortality during the COVID-19 pandemic. Blacks may be vulnerable to COVID-19 because many suffer from underlying health conditions. This is including asthma, diabetes, high blood pressure, obesity, and remember earlier I spoke about the racism tied to those conditions. Details of racial disparities came after data revealed the majority of New York's more than 5,489 deaths due to coronavirus were among men. These reports were back in April and May, and 86% of all deaths were among people who had underlying illnesses such as hypertension and diabetes. So there is a such thing called the Crisis Standards of Care. This helps hospitals ration critical resources like ventilators and ICU beds to those who are most likely to benefit from them. This recommends that hospitals use these frameworks that includes the patient's age, how critically ill the patient is at arrival, and the comorbidities. In other words, these are the underlying illnesses that can put patients who are infected with COVID-19 at a higher risk for worse outcomes. So these guidelines actually aim to treat individual cases fairly, but a system that penalizes based on the person's comorbidities or underlying health conditions will undoubtedly and unfairly penalize the populations that are already more vulnerable to those conditions. So this will almost certainly mean that the racial and ethnic minorities will be placed in the back of the line for critical care resources. Coronavirus cases and related deaths soar in cities with significant Black populations, including New Orleans, Detroit, Chicago, and New York. But only a few states have released the racial information, including Illinois, Louisiana, Michigan, New Jersey, North Carolina. Data from these states shows that Blacks are dying at a disproportionately higher rate compared to whites. In both Chicago and Louisiana, Black patients account for 70% of coronavirus deaths, even though they make up roughly a third of the population. So, what can we do? First of all, we need to know the facts. We need to divert testing and resources to at-risk and minority communities. Testing may support adequate treatment and next steps, so we need to ramp up testing and include demographics in the reporting. The facts will inform policy and programming and what resources are needed and where. Secondly, we need to improve public health messaging of COVID-19 so that it is culturally sensitive and appropriate. Faith-based communities have been known to address the health concerns of their parishioners. Public health messaging can be shared during the virtual worship services, church websites, etc. So in the meantime, please follow the advice of the experts, take care of yourself, shelter in place if you are able, physical distance 6 feet apart, Wash your hands for at least 20 seconds and wear masks or face coverings. So for more information on health disparities in general and to illustrate the impact of health disparities, please watch Unnatural Causes: Is Inequality Making Us Sick? You can go to unnaturalcauses.org. This is a 7-part documentary series that explores racial and social inequalities in health. You know, and I always say the environment in which we live is a major determinant of our health and well-being. Clean air, water, soil, plants, food supplies, and even our community environment, which includes the social determinants of health, are essential for personal health. We will continue to talk about the environment and try to answer the question, what is an unhealthy environment and how does it get under the skin? The environment's effects on our health is complicated, but there are ways that we can prevent and reduce toxic exposure. Until next time, thank you so much for tuning in. Again, I am Dr. Nicole, your double board certified family medicine and preventive medicine physician, and you can find me on drnicolemd.com. That is DRNICOLLEMD.com. Take care.